What is your background and why are you here?
My background's in sociology. I've spent 15 or 20 years researching with disabled people, and at the moment I work at the World Health Organization in the Disability and Rehabilitation Team.
And what brings you here to Stockholm these days?
I was a keynote presenter this morning talking about the World Report on Disability and the Convention on the Rights of People with Disabilities, trying to promote a human rights approach to disability. Today I talked to the conference about the fact that there are 1 billion disabled people in the world. That's 15% of the population. I introduced to them the Convention on the Rights of Persons with Disabilities, which came into force in 2008 and promotes a whole range of rights for people with disabilities, which governments which ratified the convention are legally bound to uphold. 116 countries so far have ratified. And those are not different human rights to those of everybody else, they're the same human rights. And the World Health Organization and the World Bank brought out the World Report on Disability last year, which talks about the evidence for the barriers that disabled people face and the evidence for how we can overcome those barriers and promote participation by people with disabilities.
And how does the challenge of the global social agenda affect your work and your commitment?
I think that disabled people are found among the poorest of the poor. Disability is a real development issue. So, for example, the Millennium Development Goals do not mention disability, despite the fact that disabled people are poorer, have less included, have worse educational outcomes, have worse health situations. And so I think it's really important as we go forward after 2015 to ensure that the needs and rights of people with disabilities are met. And the people here, the social workers and managers and activists here, have an important part to play in making that a reality.
If you could single out just one, or what is the most important issue for people with disabilities on a global perspective?
I would say poverty. People with disabilities are disproportionately poor. They're less likely to work, they're less likely to go to school, and as such they are seen as a cost, not as people who contribute to society, but the people who cost money, who are a burden. And so if we are able to enable disabled people to be productive, to have rehabilitation and education so that then they can contribute to their family livelihood, to their community, to their state, then they will be seen as equal members of society.
And if you please, could you describe how the attitude has changed? Has it changed at all during these last years, or is it changing? What's the progress there towards disabled people?
What we've seen over the last 20 or 30 years is the growth of the disability movement. People with disabilities doing it for themselves, organizing, campaigning, challenging, and promoting their rights. And this has led to a change of attitudes. And so, for example, you see countries like Uganda, where disability equality is written into the Constitution. The same in South Africa. You see countries like the United States of America with the Americans with Disabilities Act, and you see the Convention on the Rights of Persons with Disabilities. All of this represents a change of attitude. The understanding that disabled people are a minority who are entitled to human rights, like everybody else, and that it's about removing social barriers to empower people to take their rightful place as citizens. So I think there has been an attitude shift, but we need much more of it among doctors, teachers, families, and social workers so that people are respected and included, not seen as second-class citizens. I know that people here are working hard in their communities to make a difference. And I hope that people will learn from the presentations and the workshops and the posters that are here and go back and implement best practice, implement what we know works on the basis of good evidence, and rethink their practice, rethink their policy, things they've taken for granted. I'm hoping that people like me coming to talk to them as keynote speakers will make everybody here think a little bit more and do things a little bit differently.
And what is your impression of the conference so far?
I think it's a very diverse, very exciting place. Many generous and warm people. I think I can understand why, but it's a shame that there are fewer people from, say, Africa. There's many people from Asia, but not very many people from Africa here. And that's a shame, but I understand why that is. But what I can see is that there are a lot of very committed people here who really want to make a difference. I think that we can learn from each other so much at a conference like this. That's why it's important. And I don't think that rich countries have a monopoly on expertise. There are many, many techniques and approaches that are developed in developing countries which we could really use in countries like Britain or Sweden or America. Just to give you one example, community-based rehabilitation is a community development strategy where people are mobilized to support disabled people and to work for their inclusion. That strategy, CBR, is very active in Africa, Asia, South America. But it can also be used in remote areas of Australia. It can be used with poor communities in Britain and France. You know, CBR is an idea from the South that can be adopted by the North. I would summarize the conference in terms of ideas, practices, and hopes. People here are full of ideas. They kind of learn ideas. They've worked out good practices which they want to share, and they're going to go away with hopes of how they can make the world a better place. That's the importance of a conference like this.